Hello, I'm Dr. Pashapour, and today I want to talk to you guys about a very interesting case I got about a couple weeks ago, okay? Let's jump into it. This is a patient that came to me from New York City. Very nice lady, and she recently moved to DC area. She said she doesn't like the way her teeth look. Her front teeth were flared out on the mandibular area, and she just couldn't chew properly, didn't like the looks of her teeth, okay? So what we decided to do is we decided to stage it because she didn't want to do the whole arch at one time. She wanted to basically do it in phases, and she wanted to get crown and bridge done and not do a hybrid or all the teeth in one day, okay? If you look at this image, you can appreciate the flaring of the anterior mandibular teeth, pretty significant. Now, when you have a situation like that, not only the mandibular teeth are flared out, they're also super erupted. Because of that, the bony structures in that area is also super erupted. So this causes a problem if you're trying to restore the area, because then the crown and bridges you're going to do, they're going to follow the curvature of the bone, and they're going to look awkward, and we're going to have the same issue. So therefore, we decided to remove the teeth. And here I'm removing the teeth very slowly because I don't want to get any tear in the gingiva. If you get a tear in the gingiva, it causes issues with the recovery time for the patient. And here I'm using a acrylic burr to reduce the anterior mandibular ridge. And this amount of reduction was planned digitally based on what we wanted to do for her. The bone is nicely reduced, no sharp bony edges noted. And you don't want to remove too much again because that causes issues with the final restoration. At this point, the temporary teeth are positioned in place. It looks like they're fitting. However, we're going to adjust this to make sure it's fitted even better than that. At this point, we're drilling for placement of a middle implant. The implant is going in nicely. Very good bone contact, and at this point we're going to take the drill out and we're going to ratchet the implant into the bone. The torque again is a very good torque, and we're going to bury the implant. The idea is here to bury this implant, let it heal for 2 months to make sure the implant is nicely integrated, and then we come back and we include that implant into the bridge. We also grafted some bone around this implant in the lingual and buccal area. And here, I would say, is the most important part of the procedure. You want to make sure you get a tension-free closure with no tear. If you get a tear in the gingiva and you're putting a temporary restoration on top of it, a patient is going to complain and have a lot of pain. So we want to prevent that by doing a nice job closing the tissue without causing any laceration or a tear. And this is the temporary teeth in place. The curvature looks good. Patient is very happy. And this is just a temporary. So we come back, the tissue will adapt to the temporary, and after a few months we'll be able to do a nice bridge including all 3 implants. I really appreciate your time. I'm Dr. Pashapour. Looking forward for the next video. Take care.